morning and welcome to the Child Protection in Sport Unit webinar on eating disorders and disordered eating in sport. Thank you for joining us this morning. My name's Michelle North. I'm one of the senior consultants of the CPSU and I'll be hosting the event today. I'm joined by Carol Billington-Wood, who is another of the senior consultants within the unit, and she specialises and leads on the Eating Disorders in Sport working group and has been working quite hard on this area. Sorry, we're just catching up. Also joining us today is Dr. Carolyn Plateau. She is a lecturer in psychology within Loughborough University. She has recently completed her PhD and is joining us today with a range of experience, and she teaches around eating behaviour, clinical psychology. We're also joined by Bill Foster. Bill has been coaching for over 2 decades, and he's a coach who can relate to his athletes due to his experience in the elite field. So I'm going to hand you over to Carol.
Hi everybody. I'm just going to talk just very briefly about what we're going to cover in the webinar today. We're really running the webinar in 3 sections. The first bit is where I will talk about a bit of the context and then the background to the CPSU's role in this work. And then I'll pass over to Carolyn and we'll talk a little bit about the basics of eating disorders, eating in sport, and start to move on to talk a little bit about how you might start a conversation with an athlete or a player or somebody you've got concerns about, because that's one of the messages that we've been hearing, that people really want some help and advice around. And that'll link us in then to the middle section of the workshop, which is really a Q&A session with Bill, and we'll be able to pose some of the questions. We've got a number of questions that we've developed that Bill will be able to help us through, but we'll also open up the floor to you to ask any specific questions that you might have. And then the last section will really be looking at referrals, treatment and support that's available. There's lots of support out there and we'll be able to direct you towards that. So in terms of the context, I guess the CPSU and our involvement, there's strong and consistent evidence to show that eating disorders is highly prevalent in sport, particularly in some of the weight-sensitive sports such as endurance, the weight category and the athletic sports, as well as jumping events. But we also know from practice with working with organisations such as you guys, is that actually there's increasing concerns around eating disorders, and that's coming from all ends of sport. We're hearing concerns from club welfare officers and coaches who are contacting the league governing body safeguarding officers with concerns, but we're also hearing about it from the high performance end too. I think in terms of what we're hearing, it mirrors what's happening in society in terms of increasing numbers of eating disorders, and recent figures from the Health and Social Care Information Centre show a national rise of about 8% in the number of hospital admissions for eating disorders, and the most common age for those admissions for females was 15 and the most common age for males was 13. So we know from evidence and we know from our practice that there is an issue that we need to address. In terms of the NSPCC CPSU work, we commissioned research back in 2011 with the University of Edinburgh, and it was a 3-year study of children's experiences of participating in sport in the UK. And what the findings showed, I guess they mirrored what other studies in the UK and in Europe had highlighted, but it also showed an area of concern that sports needed to address, and eating disorders was one of these. So what I'm going to do now is just highlight really quickly what this research showed that's relevant to what we're talking about today. The first point, and the positive point, is that most young people gave a positive picture of their sport experience, and they reported the value of social aspects of taking part, all the friendships they made, and a whole sort of positive range of experiences. But what they report, they also reported a range of negative and harmful experiences. And out of that, again, most people, young people, reported a positive impact of sport on body image. But they also said for some young people, particularly those that were in performance sports, where there were technical challenges and there was a strong emphasis on appearance, and it kept appearing this term having to achieve a perfect weight. There were often graphic accounts of young people trying to reach and maintain a perfect body weight, and sometimes this had a negative impact on their self-image that often resulted in eating disorders. And 11% of participants in this UK study highlighted that they had some sort of special exercise plan that they again referred to trying to achieve this perfect weight. There were also significant levels of self-harm, and 10% of respondents reported some level of self-harm. For some, it was directly attributable to sport, but for some it actually wasn't necessarily occurring within sport. The route to self-harming was elsewhere. But for all those that reported self-harm in their interview, again, there was an association with a negative self and body image. And finally, the last point that's relevant to what we're talking about today was, again, that whilst the experience of harm occurred at all levels, as participants sort of went up the performance pathways, there was a tendency for it to increase. So there was increased vulnerability of elite athletes. And so in terms of the CPSU role, what to respond from some of these messages that we were hearing about was we identified that eating disorders would be a key theme of our work in 2013. So we actually identified it as a theme that we would focus on working with our stakeholders in safeguarding. And the first thing that we actually did was to set up a scoping meeting to try and set up some sort of pan-sport approach to eating disorders. So we invited a number of stakeholders to a scoping meeting. And this is actually the stakeholders that you're seeing now on the screen are the members of the working group, but they weren't all involved immediately. It's really sort of gradually evolved and more people have joined the work as we've started to focus on different areas, whether it's prevention or access to support and treatment. And so people have joined the working group, and it isn't exclusive. And if there are people out there listening today that think they may have a role and may have good practice or want to be involved, you know, again, follow it up after the webinar and we'll be able to hopefully connect in that way. I'm going to actually pass over now to Carolyn from Loughborough, and we're just going to get you involved again in really a little bit of an interactive poll.
Okay, good morning everyone. So the first question that I want you to have a go at this morning is to have a think about what percentage of athletes are actually meeting the criteria for a clinical eating disorder. The first question is what percentage of female athletes do you think meet the criteria for an eating disorder? So if you want to have a quick go at that question. Okay, so most of you have thought 10% of female athletes are meeting the criteria for an eating disorder. It's actually higher than that. We're looking at roughly 20% of female athletes are meeting the criteria for a clinical eating disorder. And I'll say a little bit more about that on the following slide. The next question is, what percentage of male athletes then do we think meet the criteria for an eating disorder? So again, we've got a few options there. So just have a quick go on which one you think might be the correct answer there. Okay, just have a quick go. So most people again saying D, 16% there. The correct answer actually is 8% for males. So around 1 in 12 male athletes actually meet the clinical criteria for an eating disorder. Okay, so if I just say a little bit more about that then. Around 1% of the general population actually have a clinical eating disorder. But as we've just seen from some of those statistics, actually it's very much increased amongst male and female athletes. Around 20% of female athletes and around 8% of male athletes meet the criteria for the clinical eating disorders. And those are the ones that are at the very far end of the eating spectrum. What's important as well is that actually amongst athletes we see lots of individuals showing signs of unhealthy or disordered eating practices, which are these kind of chaotic or irregular eating patterns that don't quite meet clinical diagnostic criteria, but which are potentially still quite severe and which often predict the later onset of an eating disorder. So approximately 40% of athletes do show these signs of chaotic or irregular eating patterns that could potentially make them vulnerable to a clinical eating disorder. So it does seem that the eating disorders are prevalent and are a problem amongst the athlete population. And why is this a problem from our perspective, from a health perspective? Well, we know athletes are obviously engaging in often very highly intense training, and severe or serious physiological demands on their body. This, of course, is associated with some risk, particularly when it's associated with insufficient energy availability, which is one of the key elements of the eating disorders. In addition, from our perspective as professionals, and we'll talk a little bit more about this today, particularly around identification, is the issue with actually trying to identify eating problems in sport can be quite difficult, and often sport tends to complicate that identification process. So if I just say a little bit more about why athletes are at risk. So we've seen that statistics seem to be suggesting that 1 in 5 female athletes and 1 in 12 male athletes actually present at the very far clinical end of the spectrum. Well, we know that the general population face various risk factors for eating disorders, and this we know, for example, that eating disorders are more common in adolescent females. We know that individuals face various socio-cultural pressures from the media, which can get them to evaluate their body in quite a negative way. So why then do we see this elevated risk amongst the athletic population? And the theory, or the thinking behind this, is that actually, in addition to those general risk factors that we see within the normal population, competing in sport also carries additional risks that may trigger changes in eating behaviour in a negative way. So, for example, if we think about the link between weight and performance, often that is something that is emphasised and considered to be quite an important factor within the sporting context. So, athletes and coaches may be encouraged to focus on weight as a potential factor to manipulate in order to achieve good performance. Similarly, the sporting context can, as a result, perhaps result in a greater focus on monitoring weight and draw athletes' attention to their body and to their weight and shape quite considerably in comparison to the normal population. Athletes are often expected to compete or train in quite revealing and tight clothing, which again can increase this focus on the body and the body shape, and also makes it easier for athletes to draw comparisons with their competitors and perhaps perpetuates this kind of competitive nature that we see between athletes, particularly in regards to body weight and shape. Within the sporting context as well, we also see triggers such as poor performance and injury are often related to the onset of disordered eating practices and changes to diets and eating behaviours. So experiencing low mood as a result of those particular situations may encourage changes in eating habits that are then perhaps difficult to reverse. So the sporting environment itself can attenuate focus on body shape and body weight, but sport may also attract individuals who are naturally predisposed to eating-related conditions. So sport provides a context in which individuals can focus on can engage in certain practices that perhaps would be seen as abnormal outside of that context. So, for example, engaging in a high level of exercise and also adopting quite rigid practices around food are perhaps normalised within the sporting context, but which also may be seen as quite abnormal outside of that environment. But sport may reinforce certain characteristics that elevate the vulnerability towards eating disorders. So if we think about things like perfectionism, mental toughness, commitment to training and exercise, all of those things are reinforced within the sporting context. But there are also characteristics that we would see perhaps amongst eating disorder patients. So it may encourage a greater focus on some quite unhealthy characteristics that can increase vulnerability to subsequent eating disorders.
Questions come in from Nikki, thank you. Are these findings about elite athletes rather than all athletes, and how do we define elite?
Okay, so yes, the statistics that I presented were specifically related to elite athletes. The study that it came from was actually conducted in Norway, and it was with all athletes. So they defined elite in that particular study around national and international level athletes. what we actually see is a slight reduction in statistics for athletes who are competing below those elite levels, but they are still elevated in comparison to the normal population. Thanks, Nikki. That was a great question. Okay, so if I very briefly go over the main categories of eating disorders, then hopefully for those of you who aren't aware of these, this will be a quick introduction to some of these characteristics. So anorexia nervosa is perhaps the one that most people are aware of with regards to the eating disorders. It's perhaps the one that's had the most media coverage, certainly. And it's characterised by individuals with a very low body weight. So low weight is a predominant feature of this particular eating disorder. It's also associated with an intense fear of gaining weight or becoming fat. And it tends to manifest as calorie-controlling behaviours with disturbed perceptions of body weight and shape. So individuals often perceive themselves to be much larger and bigger than they actually are. So anorexia nervosa is often associated with quite significant changes to eating behaviour, so reduction in food intake, which then results in weight loss, which can either be gradual or it can be quite sudden. And often in athletes in particular, it can be fueled by beliefs around weight for performance. So this idea that they might need to be thin in order to improve their performance can be quite characteristic of some of the early stages. I've just popped a quote on there from a female athlete with anorexia nervosa that talks around how her eating behaviour changed as her eating disorder or anorexia developed. So the second eating disorder that hopefully most of you will have heard of is bulimia nervosa. And bulimia is a slightly different to anorexia in that it tends to be characterised by episodes of dieting, but these are punctuated with kind of recurrent episodes of binge eating as well. So individuals may restrict and restrict their intake of food for a period of time, and then engage in eating large amounts of food in a short amount of time, feeling quite out of control when they engage in those binging behaviours. Binge eating is also, or bulimia nervosa is also associated with compensatory type behaviour. So you can see on the cycle there that they then often feel extremely guilty about the amount of food that has been consumed and engage in some form of compensatory behaviour or purging. And this can be self-induced vomiting, excessive exercise, laxative abuse, a variety of different techniques that are often used to try and purge the individual of the food they've consumed. It is quite a vicious cycle and can perpetuate itself quite quickly.
We just had another question in from Stephen saying, is there any evidence about a particular age group that these conditions might affect more than others?
Great question again. Yes. So eating disorders do tend to be more common, as Carol said at the start, around the adolescent age group does tend to be the period where individuals are most vulnerable. So in girls that tends to be sort of 11 to 16, and in boys that can be slightly later. But what we're actually seeing is that individuals or eating disorders seem to be occurring earlier and earlier in younger children. So yes, it does seem to be quite age specific, but that's not to say that they can't occur across the lifespan.
Great, thanks.
Okay, the next category that you might be aware of is binge eating disorder, which has very recently been assigned its own category in the clinical eating disorders. And that is similar to bulimia in that we see recurrent episodes of binge eating which are associated with this lack of control. So very large amounts of food are being consumed in these binging episodes. How binge eating differs to bulimia is that we don't see any compensatory type behaviours. So, for example, they wouldn't then go and engage in self-induced vomiting or excessive exercise, and as a result, binge eating is often associated with significant weight gain. So just to give you a little quote there from a female athlete with binge eating disorder, gives you an insight into the amount of food that are often consumed in these binge eating episodes. The final category, which is actually quite relevant to the athlete population, is these kind of other or atypical eating disorders that we often see. Now, athletes don't always fit into categories particularly nicely, and they may tend to fluctuate in terms of their eating attitudes and behaviours from one category to another. So atypical eating disorders are still clinically significant, but we might see, for example, with anorexia nervosa that they're still of a relatively normal weight, or we may see a reduced frequency of binge purge episodes amongst bulimic or binge eating disorders. So some of the signs and symptoms, what are the things that we should be looking out for across all of the eating disorders? So weight change is an obvious feature, but actually, as I've just said, with anorexia nervosa and with bulimia nervosa in particular, weight change may be quite gradual, and it may not be the easiest thing to spot, particularly if it is happening quite slowly. So it's not always a reliable feature of the eating disorders. Other things to look out for are things like increasing fatigue in training, regular injuries and illnesses, gastrointestinal problems, anxiety and low mood, so some psychological changes in the individual, so things like social withdrawal, refusing to engage with other members of their training group, for example, but also an increased adherence to exercise and perhaps a need to engage in additional exercise beyond perhaps what they would normally be doing. And you may also become aware of changes in their eating habits and attitudes. So, for example, if an athlete says that they're cutting out carbohydrates or they're changing their diet quite considerably, then that could be an early sign or symptom of a potential eating problem. Okay, so those are some of the early signs that we might be looking out for. But in actually, why is identifying eating problems in sport so difficult? And we know that it is a real challenge. From some of the research that we've done at Loughborough, we know that coaches and sports professionals really struggle with identifying these problems amongst their athletes. And part of that is to do with an assumption of good health when we see athletes performing well. It's quite difficult to challenge or to assume that there's anything other than good practice going on when an athlete is engaging or performing particularly well. And we know that actually in eating disorders, sometimes a little bit of weight loss can improve performance, certainly in the early stages, but this is quite often likely to change and go into a bit of a downward spiral quite quickly. We also have expectations around physical appearance that athletes have in certain sports, so we would expect athletes in endurance sports, for example, to be quite lean, to be quite slim. So we don't often challenge those stereotypes particularly often. So it can get more difficult to pick up on changes in individuals, particularly where they're meeting our expectations around their appearance. Awesome. Oh, question?
Just in terms of that, is there any particular link between eating disorders and athletes in weight-related? You talked about particular traits, so weight-related or weight-controlled sports.
Yes, yes. So a lot of the evidence does suggest that actually there is an increased incidence of eating disorders amongst those athletes in lean sports or in sports where weight is perhaps identified as a key feature. So if I give you an example, athletic sports like gymnastics, endurance sports like endurance running or triathlon, we do see a higher prevalence of eating disorders in those particular sports, perhaps again because of that link with weight that does seem to be tied in with performance quite closely.
And is that the same with, say, boxing or judo and the weight-making sports?
Yes, yeah. So again, with anything where athletes have to meet certain quite strict criteria often around their weight, can promote quite disordered eating practices as well. Yes. So the other point I just wanted to make on there was this idea that actually we reinforce sometimes within the sporting context around eating disorder what we would consider quite unhealthy traits perhaps in other contexts. So we often reinforce perfectionism, we reinforce high levels of commitment to training and a high adherence or rigidity around diet, and this can often perpetuate but also can make detecting particularly unhealthy practices quite difficult. So it's quite tricky to differentiate between what's acceptable within the sport context and actually what might be going down the route towards an eating disorder. Also, there's some issues around whose responsibility it is to deal with a potential eating problem. There's quite high levels of uncertainty and lack of confidence when it comes to identifying eating problems in sport. I know in some of our work with coaches, they're often quite fearful about making the problem worse and have a particular lack of confidence around their own levels of knowledge when it comes to identifying whether or not there's an issue. So the tendency is perhaps to leave it to someone else. Okay, let's just do a quick poll then around who has a role in supporting athletes with eating disorders. Who do you think is important when it comes to supporting athletes with potential eating problems? Just give you a couple of minutes. Okay, so most people have said D. I would actually argue that all of those people on that list have a role to play in supporting athletes who may be presenting with those eating disorders there. So it is about perhaps thinking around shared responsibilities, even if it's just a matter of signposting the individual to treatment, or raising the issue with a parent or raising the issue with the athlete. Trying to get that individual into treatment as soon as possible is imperative. Okay, if we then think about how we go about approaching an athlete. So this is something that I know lots of people have struggled with, and one of the reasons we wanted to talk about it today, and also to get a coach's perspective on this. So some of the work we've done at Loughborough has told us that there's kind of three main ways in which individuals might go about approaching someone who has a potential eating disorder. And that's not to say that this isn't kind of dependent on individual situations, but it certainly is a nice way of perhaps thinking about how we tend towards identifying certain individuals. So one of the things we saw is that actually lots of people take an avoidant approach towards these issues. So head in the sand, trying not to think about it, waiting for someone else to take action. And that can be very tempting, particularly if you're not very confident in your own knowledge and perhaps you're concerned about potentially making the problem worse. Another type of approach that we see very often is this type of confrontational approaches that we see some people embarking on. This tends to be quite accusatory, trying to use scare tactics, for example, to persuade an athlete into a reaction, you know, providing them with some statistics and trying to scare them into that they have an eating disorder. This can be quite counterproductive in that it often closes down communication channels and may promote further secrecy on behalf of the athlete. What we actually want most coaches or professionals in sport to work towards is adopting a supportive approach. And some of the coaches and professionals that are able to do this are able to work very closely with the athlete, encourage the athlete to seek support, and try and keep those communication channels open as far as possible. And it may be that you might require additional support from professionals in order to be able to maintain a supportive process. So in terms of potential conversation starters then, how do we actually start that conversation with an athlete? And I think some of the key messages around this are that it needs to be done privately, so on a one-to-one basis. It needs to be sensitive because these are incredibly difficult conditions that often promote high levels of guilt and secrecy amongst the individuals. And to be non-judgmental or critical in your approach. What's also helpful is to try and avoid the term eating disorder. So try not to label an individual with an eating disorder if that diagnosis hasn't been assigned. So try to be direct, straightforward, and use I statements for reasons for your concern. Make it clear that you are concerned and that the conversation won't stop here, so you are going to persist with it. And you may get some agreement, or you'll most likely get some denial. But either way, you can be helpful and you can try and keep those communication channels open. So one example here is asking the athlete if they're okay, expressing concerns around their health and perhaps some weight loss, and to encourage them to go and pop along to their GP for an evaluation, and being supportive in that process. Framing the issue in terms of potential performance improvements can also be helpful and can perhaps be more appropriate when you're dealing with athletes. So, for example, in this example I've said perhaps notice that the athlete's feeling tired, ask them to sit down with a nutritionist or a doctor to see if there are any strategies that they could adopt to help make the athlete stronger and to ensure they reach their full potential. So framing it in terms of performance improvement can sometimes be helpful. When you are opening a conversation around eating disorders, be prepared for denial. These eating disorders are highly secretive, and athletes often don't recognise when they do have a potential issue. So be prepared for that, and don't assume that you've made a bad approach, or you've opened the conversation in an inappropriate way because they haven't admitted to you first off. It might take time. Try to maintain the communication channels and remain approachable throughout the process. As I said, it might take more than one approach in order to get the athlete to admit to a potential problem and to get them to seek support. So patience and persistence are key here. But don't be afraid to ask for additional support and advice, and we'll cover later on in the webinar how we can, what options and what resources are out there to help you, and where you can go for additional support and advice. Okay, I'm now going to hand over to Carol and Bill, who are going to do the Q&A in today's session.
Thanks, Carolyn. That was really helpful. What we'll try and do now is follow on some of that sort of advice that you've given around starting conversations and the practicalities of how that worked and Bill's experience. Bill is the coach at Loughborough Students Athletics Club, primarily the women's endurance coach, and has been coaching for over 2 decades. So welcome, Bill. Thanks for coming along today. Hello. Just the first question, really. Just what sort of challenges have you faced in approaching athletes where there might be concern about eating or an eating disorder?
I think it's really important for coaches to be aware of all of their athletes and to decide if you're increasing training, you need to increase it gradually, not sudden massive increases in training. And you need to be aware of the athletes. And sometimes if you've noticed somebody's lost a bit of weight, or some of the behaviours that Carolyn mentioned before. I have a monthly meeting with all of the girls that I coach, just on a one-to-one over a cup of coffee or whatever, and I tend to discuss it at those meetings. I certainly avoid discussing it in front of other athletes and in a group situation. I think it's really important that it's raised at those monthly meetings, and sometimes I find an athlete will be quite open and talkative about it right from the word go, and other times they might not say anything, and you then sort of move on and then bring it up at the next monthly meeting. So it's just being aware of all your athletes, but I think it's definitely important to raise the subject if you are concerned about something.
Brilliant. Can you sort of share a bit about your experiences of how you've approached athletes about the issue?
Well, I think if I have an athlete who has lost some weight, and I'm concerned about that, because a lot of them, they need to be aware that they need to eat really well and get in a lot of energy to cope with the amount of training that they're doing. I mean, if you're increasing their training has to be a long-term program. You want to be very careful making sudden big increases in training. And endurance athletes are training really hard. They have to eat really well, and they have to have eat well after a hard training session. They have to be very aware that they need to have a really good diet. So you're discussing that with all of the athletes. A lot of athletes say to me, "Oh, do you think I need to lose a little bit of weight?" And they don't. And I think that's another area that you have to be really careful about, is you have to give reassurance to a lot of athletes that they are actually fine, and then they need to really eat well and to cope with the training, the training that they're doing. But if somebody is losing weight, then I will say to them, I'm a bit concerned. You seem to have lost a little bit of weight. Is that something you thought about? What do you think? Trying to get them to talk to you about it.
We've got some questions coming in. It might be just to kind of throw them in at the moment. So when and how do you approach the idea of reducing training if the problem isn't improving, or would you?
Yeah, I do reduce the training, and although I'm coaching quite a big group, there's quite a wide range in age and the amount of training that they've done. So I often say it's like a 5-year program, endurance running. You're just increasing it a little bit year by year and not making sudden jumps. If I think somebody has lost a little bit of weight and I'm concerned about that, then when I'm doing their next monthly plan, I will be very careful not to increase their training, and often I do reduce their training.
Just one more question before you move on is, have you approached any male athletes with these issues?
I'm the club coach at Loughborough University for the women's endurance group, so I'm really not involved with the male athletes. I used to coach 1 or 2 male athletes, but when I was appointed in 2001 as the endurance coach, I look after a group of 30-35 athletes, so I'm really specifically involved with the female group.
Okay.
Can I just add to that? This is Carolyn again. Just thinking, as I said earlier, they are often positioned, eating disorders, as female specific problems, but we know that really isn't the case. Some of the statistics are showing that actually they are quite increasingly common in male athletes. So, you know, the same advice goes for kind of approaching the question with a male athlete, and perhaps thinking around some of the stereotype issues that we were talking about earlier. You know, don't just be looking for these issues amongst female athletes. They are on the rise in male athletes as well. So that's a really good point raised by a listener. Thank you.
Great, thanks. Keep your questions coming.
Right, just moving on to another question. What advice, Bill, would you give to other coaches or practitioners working with athletes who might have a potential eating issue?
I think it's so important for all coaches working in all sports, but certainly in endurance sports that I'm involved, to be really careful what you do say to athletes, because sometimes somebody who ends up with an eating disorder, that can have been the trigger in the very beginning, a coach saying you need to lose weight, or, you know, some flippant comment that you might think is not important. So I think it's just really essential that you're reassuring and don't make critical comments, especially in front of other athletes. And as I mentioned earlier, sort of almost most athletes are thinking, do I need to lose a little bit of weight? Will I run better if I lose some weight? And you need to be reassuring and emphasizing the importance of maintaining a healthy diet, because if you do lose a lot of weight, then that has long-term effects on low bone density, increased incidence of stress fractures, and that can be an issue. Occasionally people will lose weight and do quite well for a short period of time, and that's one of the problems that we all face in endurance sports. They can do quite well for a short period of time, but long term it really doesn't work. You have increased injuries, extra fatigue, and that reduces long-term performance. So I think those are all important issues.
Where did you go for more information?
Yeah, I know Alan Curry, who is an expert, a doctor who's an expert on eating issues, and I've done some work with him in previous years. And I think, you know, on the internet and through different, you know, GPs, BEAT, other national governing bodies, British Athletics, you can approach them. There is quite a lot of support out there, but it is also really important that the coach doesn't sit back and say, you know, rely on other people, because sometimes it can take a little bit of time to get something organised through the NHS or you know, so the coach does have to have a little bit of an input into it, and not all some really elite athletes can have free access to all sorts of experts, but so the coach does have a responsibility.
Interestingly, on the back of that, questions come in is, how do people challenge if they feel a coach hasn't handled something very well or done it quite poorly? Is there anything that people can do if they think a coach isn't handling it well?
Yeah, that's an interesting. I mean, because I'm not sure that all coaches do handle it well, and some of the comments that I made earlier about coaches. I mean, there's even been stories of coaches having a weigh-in to check athletes' weights in front of other people, and this type of thing, and you know, that really can lead to problems. I don't know if Carolyn or Carol would like to make any comments.
I guess one of the things I was thinking when that question came in was that often it appears that sometimes within sport the eating disorder concerns or the concerns around other issues like self-harm don't necessarily get picked up as safeguarding concerns, and so the lead safeguarding officers are not necessarily hearing them, and that's something that the working group is really pushing forward, that sort of whole communication that this is a safeguarding issue and it needs to be picked up. A lot of governing bodies are finding that it is being picked up through club welfare officers, which is great. And it's interesting that Bill mentioned Alan Curry, because Alan Curry has done a lot of work with British Athletics and is part of the working group in terms of helping to put structures in place to make sure that these concerns are reported. But yeah, I think that is something that a lot of people are facing, you know, perhaps felt like it hasn't been handled well, or perhaps a little bit of avoidance and not recognising it. And so it's a little bit of education really that it needs to come through as a safeguarding concern.
And just to add to that, you know, coaches, if there are any listening to this morning, you know, we wouldn't expect you to necessarily handle these issues by yourself. as Carol said, you should be flagging this up to welfare officers and to safeguarding officers in your club or in your region, and you know, seek additional support. What's important is that often coaches are in a really good position in order to be able to identify when these issues start to become apparent, and actually flagging those up to someone else is really important to try and get the athlete into treatment as soon as possible. So you know, don't feel like you have to deal with these issues on your own, and we certainly wouldn't expect you to kind of become a psychologist or a nutritionist as well as being a coach. So do try and get other people involved.
Great. I think on the last question, what support do you think helps coaches dealing with these problems? And this is quite an interesting one, because this is what we're looking at as a working group, as to what support coaches, or not just coaches, but practitioners, welfare officers who are dealing with these issues.
Yeah, well, I think, as I say, you sort of start off the program and then get the athlete to talk about it. That's one of the key things, is getting the athlete to talk with you about it, and then getting the athlete to think, well, maybe where should we take this? Shall we contact governing bodies, or shall we go through your GP and try and get some professional help? And so you do need to bring in other people to, you know, to help you, because sometimes with a coach you can certainly help to solve the problem, especially in the early stages. If you start saying you've lost a little bit of weight and we're trying to work on that, or if an athlete's been out injured a long time as well and they put on a bit of weight, they're worrying about it. But inevitably there are one or two cases where you definitely do need to try and get professional help, and the national governing bodies, there are you know, there are some people that you can contact within your own sport, and also through your GP. I mean, the nutritionist can help, but I don't think that's always the issue. Often the athlete knows what they should be eating. The problem is actually getting them to do that, and you know, they're often very knowledgeable about nutrition, so it's not necessarily the nutritionist that's the best person to help.
That's great, thanks Bill. We will come back at the end if we've got time and take more questions to Bill, but just to keep pressing on, I'm going to pass back now to Carolyn, just to get you involved again in a quick poll.
Okay, let's see how well you've been saying so far. So just a couple of true or false questions that I want you to have a go at now. The first one: you can tell if someone has an eating disorder just by looking at them. Is that true or is that false? Okay, I think pretty much everyone has said false for that one, and that is correct. Yeah, so you know, the eating disorders do come in all shapes and sizes, particularly the atypical eating disorders and bulimia as well. So you know, just by assuming that the athlete's lost some weight or is particularly thin isn't necessarily a good marker of a potential eating disorder. Okay, the second one on there. Eating disorders are caused by sports involvement. Is that true or is that false? Good. I think everyone again has gone with false on that one, which is correct. So sport can sometimes trigger or exacerbate eating disorders in people who are potentially already vulnerable. But you know, sport on the whole, as Carol was saying right at the start, is a very positive experience for most individuals. And it's only perhaps in some individuals where it starts to result in issues. Okay, last one. Athletes with eating disorders won't be able to perform properly. Is that true or is that false? Okay, so a bit of a mix on that one, I think. Most people are saying false, which is again right. So actually what we see in terms of some of the things Bill's been saying and that I was referring to earlier, sometimes weight loss or a little bit of change in eating behaviours can result actually in an improved performance, certainly in the early stages, but it may be it should become apparent quite quickly, particularly if the weight loss continues, that performance will start to deteriorate, but that is often at a slightly later stage. So even if performance does start to increase initially, still be looking out for signs of weight loss that may have prompted that performance improvement. Okay, so those are commonly held myths, I suppose, around the eating disorders, but you've all done really well on those, so well done for that. Okay, I'm going to briefly go through the referral process and some of the treatment pathways just to kind of demystify this process, because I think sometimes it's not particularly well understood. The GP, as we've referred to so far this morning, is really the first point of access. Most referrals to any specialist support will need to go through the GP. So encouraging the athlete to go and have an evaluation by a GP is a really important part of this process. Some elite or national governing bodies may have separate pathways for elite athletes, and I'll give you an example of British Athletics. They do have their own specific pathway or plan in place for any elite athletes who are funded, who get signposted directly into private healthcare, and they've got a relationship with a private healthcare provider who sees any funded athletes very quickly. So get to know your sport and try and find out if there are any specific pathways for funded athletes. The reality is that actually most of the athletes that you might come across will not be on that pathway, and perhaps that's again something that makes identification quite challenging because they're not in those supportive environments. So most individuals will need to go through the GP if they want to access specialist support. The type of treatment that the athlete will receive will largely depend on the type of eating disorder that they have and also the level of severity. If you can pick up eating disorders at the early stages, then most eating disorders can be treated on an outpatient basis. Weekly meetings with a therapist that might go on over a period of kind of 4 to 5 months. Often, if it's being treated on an outpatient basis, the individual can carry on with their sport, but that does largely depend on whether or not sport might be perpetuating the disorder. Inpatient treatment, on the other hand, is often assigned particularly to low weight eating disorders, so individuals presenting with severe anorexia will normally require kind of inpatient support in order to initiate weight gain and to encourage balancing of their eating habits. And this type of treatment will normally require suspension of involvement in sport, at least for the period of time they're involved or that they're on an inpatient unit. And that's quite an intense form of treatment. But ideally, we'd be hoping to pick up these disorders before we get to the need for that type of drastic level of support. So it can be treated on an outpatient basis. So quick look at a referral pathway then. If we raise a concern about an athlete's eating behaviours or attitudes, the athlete is then advised to see the GP, as we've discussed. If we go down my left-hand side of the column, the GP then refers the patient for an outpatient appointment, which carries with it a potentially 3 to 6 month waiting list. So it's not a quick process, and you and the athlete and anyone else involved will need to be patient at this point, because there is quite a long waiting list for outpatient support. The athlete may also be referred to local clinics, support groups whilst they're waiting, but also as part of the therapy. And they are often permitted to train as long as they're meeting kind of health maintenance criteria, and there aren't any major concerns about the way in which the sport contributes towards the eating disorder. On the other hand, inpatient support is often initiated much more quickly than the outpatient support, usually because of the medical concerns with the athlete. It is an intensive process that can take quite some time in order for the athlete to get through, particularly if the athlete isn't necessarily being compliant with treatment. And often training is withheld until they do become treatment compliant, or until they're medically stable in order to be able to train. So as I said, British Athletics do have their own funding process. They support elite athletes through a funding pathway, and they signpost them onto a private healthcare provider. But they do also have a referral process for non-funded athletes, where they ask for all concerns to be directed to the UKA Welfare Officer, Jane Filan, and then Jane signposts onto other sources of support that athletes within British Athletics can access. So this is just one example of a national government body pathway that is available. So as I said, treatment options vary according to the nature of the disorder, but it will usually involve some form of individual psychotherapy. There may also be group therapy components, which can complement individual therapy. In adolescents in particular, those with anorexia nervosa, that may involve some kind of family therapy, and also there may be some pharmacotherapy in the SSRI, so treatment for comorbid depressive conditions or anxiety may also be assigned. But please be patient with the treatment process because it can be quite lengthy. So how can you support an athlete going through treatment for an eating disorder? Firstly, try and encourage compliance with therapy, because this is really important to encourage a quick transition through the therapeutic process, and will speed up their ability to get back to their sport. Treatment should, however, take precedence over training and competition, but do seek advice from the therapist or the doctor that you're working with about whether or not an athlete can continue to train. Coaches, family members and others can be involved in treatment at the request of the athlete, but again check with the therapist that you're working with as to whether or not that's appropriate. And think of it as a bit of a rehabilitation process, a little bit like dealing with an injury, so it will take some time in order for the athlete to recover, so be patient. Okay, I'm going to hand over to Carol now.
Thanks, Carolyn. I'm just going to whiz through the last couple of slides. So just the Eating Disorder in Sport guidelines for practitioners was a resource that was produced by UK Sport back in 2007. And what we found is that the information and the resources contained in that are still really relevant. However, what we want to do is to review it in two ways. We want to review any information that's new since 2007. So, for example, the IOC guidance around relative energy deficiency, and also really getting across the message that it isn't just about female athletes, it's about male athletes. So it's reviewing it in terms of updating it, but it's also reviewing it to make it relevant for sport, so that it's not just something for practitioners working in high performance sport. So it's how it might work across all levels, and particularly community levels. And it's great that we've got Denise on the line, because Denise has been doing some work with us in Nottingham, looking at how we can make those resources relevant for community coaches and for people working at the grassroots of sport. So that work's underway, currently being reviewed. Want to signpost some of the support organisations that Carolyn mentioned, and BEAT is really a charity that supports and has a huge amount of resources. There are two particular resources that we often signpost that are on the BEAT website, which is a guide for athletes and a guide for coaches, but there's lots of other resources around, I guess, helplines, particularly a youth line that many governing bodies are now actually signposting from their website. So you'll get copies of all these resources, so hopefully they'll be useful. But I just want to really finish and give you the opportunity now for any questions that you might have for Carolyn or for Bill or for myself about the work of the working group.
We've had loads of questions, and thank you so much. One of the ones that come to mind is, thanks Emma, most of this is focused on weight loss, and seeing this as a potential sign of an eating disorder. So is weight gain also a potential sign, and is there any inherent danger in talking to an athlete about this?
I'll pick that up and then I'll pass that over to Bill. Yes, so with bulimia and with binge eating disorder and some of the atypical eating disorders, often we see a fluctuation in weight as one of the key characteristics. So if you are seeing athletes who are kind of yo-yoing a little bit with their weight, that can be quite a good indicator of a potential bulimic type disorder, where they're kind of going through periods of restriction and also going through episodes of binging. So yes, it's definitely not all about weight loss, and I would encourage you to look for weight change as a result, rather than specifically looking for a decrease in weight.
Yeah, I think it's a lot. It is difficult for coaches with bulimia because it isn't always so easily recognised. I mean, with anorexia and those issues, and often athletes have lost quite a lot of weight, but you can't necessarily tell by looking at somebody if they've got bulimia. And as a coach, you're only seeing that athlete a few days a week. So, but yes, sometimes you do occasionally see people who are going up and down quite a bit, and again, that would be something that you would talk about with your monthly regular one-on-one meetings. It's something that you would talk about on an individual basis rather than in front of anybody. And you're sort of talking about diet and nutrition to an extent with all your athletes. You know, are you eating well? How's it all going? And they've got the opportunity then to open up or discuss or ask any questions without anything. But again, if somebody's weight is fluctuating a lot, it is something to speak to them about.
That's great. I think we've probably got time for one more question, and there's been a number of them around the subject of parents. So if I just ask one, and then we can feed back after the webinar. So it's in terms of how do you engage with parents in terms of any concerns that you might have around concerns about athletes eating?
I guess, I mean, that's a difficult one. I'm not going to dive at you, Bill, because most of your athletes are probably older, university age. But in terms of the parents, I think it's almost what we're hearing from sport is it's giving sound nutritional messages, being able to messages around good nutrition that they're struggling with. So a lot of parents, maybe particularly in sports, we're hearing from gymnastics where people are rushing from school, rushing to training. There's a whole sort of gap there around sound nutritional messages. And one of the members of the working group we have is the English Institute of Sport, and they produce some good resources. We've got some examples from gymnastics, I'm thinking specifically, which is information for parents about helping them to really, I guess, support their young performers, their young children through good nutrition. And I guess at the far end of the extreme, there have been cases where there's been denial of parents around a young person with an eating disorder that have actually resulted in referrals to children's services. So I guess there's a whole extreme of how a parent may well be involved. One other thing that I was picking up, I think, by looking at the questions that were coming in, there were quite a few questions about weight making sports, and there is guidance in the UK Sport resource that you'll find, it was a couple of slides ago, that really highlights, I guess, advice for people working in weight-making sports. And now I would just emphasise again that a lot of that work, although it's 2007, it is still relevant, it is being reviewed, but what's there is still relevant, and it's now gone back live on UK Sports website. So if you click on that link, you'll be able to get hold of that.
I think we've almost run out of time now, so I just want to say thank you ever so much for Carolyn and to Bill and to Carol. Thank you for taking part and all your questions.